But the virus does a variety of things, and we know that in the early days people feel hot, very hot, extremely hot. And we also know that those peaks of temperature carry on blipping up and down for quite a long time, sometimes for more than a week, sometimes for more than 2 weeks, even while the person is actually getting better. And then if it's going to cause them a lot of bother in their respiratory system, it starts mainly with a cough, and it's an irritating, dry cough. And it carries on making them cough. Now, people can deal with being hot and having a cough at home. Neither of those is an anxiety-inducing symptom from a medical point of view. So we just advise people who are very hot to keep themselves well hydrated. If they're getting so hot that it makes them feel cold and shivery, you know, that odd thing where when your temperature is very high, you then get very, very shivery. They use paracetamol to keep their temperature down a bit, tepid drinks, stay hydrated. And coughing, we're advising just Linctus or honey or just something that soothes the throat. But some people will go on to get an infection lower down in their respiratory tract, and it will start to cause problems in their lungs. And that can start to make people have not only a cough, but also feel breathlessness. And people can start to notice that they're breathless when they're trying to get up the stairs, for example. At that point, if they're starting to feel breathless and the breathlessness is starting to trouble them, that's the point at which we're being advised to use the 111 advice line online if you can do that, and if not, by telephone. And eventually you will talk to a GP through that system who will talk to you in more detail and will give advice about carrying on managing at home, or who will say, actually, I think that you're struggling enough with your breathing that it might be a good idea if you come into hospital. And the invitation to hospital, of course, can be declined. And there are people who know that even if I'm so sick that I'm risking my life by not going to hospital, I don't want to be separated from my wife of 60 years, particularly if I might die when I'm away. I'm going to stay home and take my chances. And their primary care team will help to look after them if that's their decision. But there are more options for comfort care in hospital. It's easier to have access to oxygen. It's easier to have access to a machine called CPAP, which works by blowing oxygen at high pressure through a mask across your nose or across your nose and mouth. So it's a kind of ventilator, but it's not an intensive care unit sort of ventilator. And of course, there are some people who are so sick that they need their breathing to be taken over by a ventilator until their lungs have recovered, or until, sadly, their lungs are not able to recover and it becomes apparent that the person isn't going to survive. And most of the people who die from COVID die from this lung inflammation and a septic type condition where actually their body organs just can't cope with the onslaught of being so sick for so long.